a WikiVidi Documentaries production. Don't forget to like and subscribe. Enjoy. Ketogenic diet. The ketogenic diet is a high-fat, adequate protein, low-carbohydrate diet that in medicine is used primarily to treat difficult-to-control epilepsy in children. The diet forces the body to burn fats rather than carbohydrates. Normally, the carbohydrates contained in food are converted into glucose, which is then transported around the body and is particularly important in fueling brain function. However, if there is little carbohydrate in the diet, the liver converts fat into fatty acids and ketone bodies. The ketone bodies pass into the brain and replace glucose as an energy source. An elevated level of ketone bodies in the blood, a state known as ketosis, leads to a reduction in the frequency of epileptic seizures. Almost half of children and young people with epilepsy who have tried some form of this diet saw the number of seizures drop by at least half. And the effect persists even after discontinuing the diet. There is some evidence that adults with epilepsy may benefit from the diet, and that a less strict regimen, such as a modified Atkins diet, is similarly effective. The most common adverse effect is constipation, affecting about 30% of patients. This was due to fluid restriction, which was once a feature of the diet, but this led to increased risk of kidney stones and is no longer considered beneficial. The original therapeutic diet for pediatric epilepsy provides just enough protein for body growth and repair, and sufficient calories to maintain the correct weight for age and height. The classic therapeutic ketogenic diet was developed for treatment of pediatric epilepsy in the 1920s and was widely used into the next decade, but its popularity waned with the introduction of effective anticonvulsant medications. This classic ketogenic diet contains a 4:1 ratio by weight of fat to combined protein and carbohydrate. This is achieved by excluding high-carbohydrate foods such as starchy fruits and vegetables, bread, pasta, grains and sugar, while increasing the consumption of foods high in fat such as nuts, cream, and butter. Most dietary fat is made of molecules called long-chain triglycerides. However, medium-chain triglycerides made from fatty acids with shorter carbon chains than LCTs are more ketogenic. A variant of the classic diet known as the MCT ketogenic diet uses a form of coconut oil, which is rich in MCTs, to provide around half the calories. As less overall fat is needed in this variant of the diet, a greater proportion of carbohydrate and protein can be consumed, allowing a greater variety of food choices. In the mid-1990s, Hollywood producer Jim Abrahams, whose son's severe epilepsy was effectively controlled by the diet, created the Charlie Foundation to promote it. Publicity included an appearance on NBC's Dateline program and First Do No Harm, a made-for-television film starring Meryl Streep. The foundation sponsored a multi-center research study, the results of which, announced in 1996, marked the beginning of renewed scientific interest in the diet. Clinical trials and studies in animal models suggest that ketogenic diets provide neuroprotective and disease-modifying benefits for a number of adult neurodegenerative disorders. As of 2012, there is limited clinical trial data in these areas, and, outside of pediatric epilepsy, use of the ketogenic diet remains at the research stage. Epilepsy. Epilepsy is one of the most common neurological disorders after stroke, and affects at least 50 million people worldwide. It is diagnosed in a person having recurrent unprovoked seizures. These occur when cortical neurons fire excessively, hypersynchronously, or both, leading to temporary disruption of normal brain function. This might affect, for example, the muscles, the senses, consciousness, or a combination. A seizure can be focal or generalized. Epilepsy may occur for a variety of reasons. Some forms have been classified into epileptic syndromes, most of which begin in childhood. Epilepsy is considered refractory when 2 or 3 anticonvulsant drugs have failed to control it. About 60% of patients will achieve control of their epilepsy with the first drug they use, whereas about 30% do not achieve control with drugs. When drugs fail, other options include epilepsy surgery, vagus nerve stimulation and the ketogenic diet. History. The ketogenic diet is a mainstream dietary therapy that was developed to reproduce the success and remove the limitations of the non-mainstream use of fasting to treat epilepsy. although popular in the 1920s and 30s. It was largely abandoned in favor of new anticonvulsant drugs. Most individuals with epilepsy can successfully control their seizures with medication. However, 20–30% fail to achieve such control despite trying a number of different drugs. For this group, and for children in particular, the diet has once again found a role in epilepsy management. Fasting. Physicians of ancient Greece treated diseases, including epilepsy, by altering their patients' diet. An early treatise in the Hippocratic Corpus on the sacred disease covers the disease it dates from. Its author argued against the prevailing view that epilepsy was supernatural in origin and cure, and proposed that dietary therapy had a rational and physical basis. In the same collection, the author of Epidemics describes the case of a man whose epilepsy is cured as quickly as it had appeared, through complete abstinence of food and drink. The royal physician Erasistratus declared, one inclining to epilepsy should be made to fast without mercy, and be put on short rations. Galen believed an attenuating diet might afford a cure in mild cases and be helpful in others. The first modern study of fasting as a treatment for epilepsy was in France in 1911. 20 epilepsy patients of all ages were detoxified by consuming a low-calorie vegetarian diet, combined with periods of fasting and purging. 2 benefited enormously, but most failed to maintain compliance with the imposed restrictions. The diet improved the patient's mental capabilities, in contrast to their medication, potassium bromide, which dulled the mind. Around this time, Bernard McFadden, an American exponent of physical culture, popularized the use of fasting to restore health. His disciple, the osteopathic physician Hugh Conklin, of Battle Creek, Michigan, began to treat his epilepsy patients by recommending fasting. Conklin conjectured that epileptic seizures were caused when a toxin, secreted from the Peyer's patches in the intestines, was discharged into the bloodstream. He recommended a fast lasting 18 to 25 days to allow this toxin to dissipate. Conklin probably treated hundreds of epilepsy patients with his water diet, and boasted of a 90% cure rate in children, falling to 50% in adults. Later analysis of Conklin's case records showed 20% of his patients achieved freedom from seizures and 50% had some improvement. Conklin's fasting therapy was adopted by neurologists in mainstream practice. In 1916, a Dr. McMurray wrote to the New York Medical Journal claiming to have successfully treated epilepsy patients with a fast, followed by a starch and the sugar-free diet, since 1912. In 1921, prominent endocrinologist H. Rawle J. Allen reported his experiences to the American Medical Association convention. He had seen Conklin's success firsthand and had attempted to reproduce the results in 36 of his own patients. He achieved similar results despite only having studied the patients for a short time. Further studies in the 1920s indicated that seizures generally returned after the fast. Charles Howland, the parent of one of Conklin's successful patients and a wealthy New York corporate lawyer, gave his brother John a gift of $5,000 to study the ketosis of starvation. As professor of pediatrics at Johns Hopkins Hospital, John Howland used the money to fund research undertaken by neurologist Stanley Cobb and his assistant William G. Lennox. Diet. In 1921, Rollin Woodyard reviewed the research on diet and diabetes. He reported that 3 water-soluble compounds, beta-hydroxybutyrate, acetoacetate and acetone, were produced by the liver in otherwise healthy people when they were starved or if they consumed a very low-carbohydrate, high-fat diet. Russell Wilder, at the Mayo Clinic, built on this research and coined the term ketogenic diet to describe a diet that produced a high level of ketone bodies in the blood through an excess of fat and lack of carbohydrate. Wilder hoped to obtain the benefits of fasting in a dietary therapy that could be maintained indefinitely. His trial on a few epilepsy patients in 1921 was the first use of the ketogenic diet as a treatment for epilepsy. Wilder's colleague, pediatrician Minnie Peterman, later formulated the classic diet, with a ratio of 1 gram of protein per kilogram of body weight in children, 10–15 grams of carbohydrate per day, and the remainder of calories from fat. Peterman's work in the 1920s established the techniques for induction and maintenance of the diet. Peterman documented positive effects and adverse effects. The diet proved to be very successful in children. Peterman reported in 1925 that 95% of 37 young patients had improved seizure control on the diet, and 60% became seizure-free. By 1930, the diet had also been studied in 100 teenagers and adults. Clifford Barbour, also from the Mayo Clinic, reported that 56% of those older patients improved on the diet and 12% became seizure-free. Although the adult results are similar to modern studies of children, they did not compare as well to contemporary studies. Barbour concluded that adults were least likely to benefit from the diet, and the use of the ketogenic diet in adults was not studied again until 1999. Anticonvulsants and decline. During the 1920s and 1930s, when the only anticonvulsant drugs were the sedative bromides and phenobarbital, the ketogenic diet was widely used and studied. This changed in 1938 when H. Houston Merritt and Tracy Putnam discovered phenytoin, and the focus of research shifted to discovering new drugs. With the introduction of sodium valproate in the 1970s, drugs were available to neurologists that were effective across a broad range of epileptic syndromes and seizure types. The use of the ketogenic diet, by this time restricted to difficult cases such as Lennox-Gastaut syndrome, declined further. MCT diet. In the 1960s, it was discovered that medium-chain triglycerides produce more ketone bodies per unit of energy than normal dietary fats. MCTs are more efficiently absorbed and are rapidly transported to the liver via the hepatic portal system rather than the lymphatic system. The severe carbohydrate restrictions of the classic ketogenic diet made it difficult for parents to produce palatable meals that their children would tolerate. In 1971, Peter Hutton-Locker devised a ketogenic diet, where about 60% of the calories came from the MCT oil, and this allowed more protein and up to 3 times as much carbohydrate as the classic ketogenic diet. The oil was mixed with at least twice its volume of skimmed milk, chilled, and sipped during the meal or incorporated into food. He tested it on 12 children and adolescents with intractable seizures. Most children improved in both seizure control and alertness, results that were similar to the classic ketogenic diet. Gastrointestinal upset was a problem, which led one patient to abandon the diet, but meals were easier to prepare and better accepted by the children. The MCT diet replaced the classic ketogenic diet in many hospitals, though some devised diets that were a combination of the two. Brought to you by WikiVidi Documentaries. Would you like to know more?